Hello and welcome to the first episode of The Heartline, a series by Heart to Heart where we interview healthcare professionals across a variety of fields in order to give you, the viewer, professional knowledge on heart health. I'm your president and host for this episode, Manushi Upreddy, and today we will be discussing the common misconceptions regarding heart health with Dr. Binita Nepal. She is a board-certified international medical physician and dedicated leader in preventative healthcare. Dr. Nepal spent over a decade working with underserved populations, focusing on chronic disease management and accessible care for the elderly and vulnerable communities in Dallas, Texas. She currently serves as a medical pod leader at Harmony Cares and is the president of KPALS, a US-based nonprofit helping build affordable children's hospitals in Nepal. Her work reflects a deep commitment to health equity, community service, and empowering future healthcare professionals. So, Dr. Nepal, I just want to thank you for being here today with us and giving us your time.
Thank you, Manushi, and thank you for that wonderful introduction.
Yes, of course. So let's just dive in straight with the questions. As I said, you currently work in internal medicine. So can you tell us a little bit about how internal medicine relates to heart health?
Sure. So, yeah, I am an internal medicine physician and I work as a primary care provider. So, primary care physicians are basically the first person, first doctor a patient goes to. So, it helps me detect those early signs of conditions, and then I don't just try to treat the diseases, I try to prevent them. So, since the heart is the center of almost everything in the body, I often deal with conditions like high blood pressure, diabetes, high cholesterol, all of that. Those are major risk factor for the heart disease.
Mm-hmm. So how often do you see patients with heart problems?
Every day, almost all my patients, so I basically work with elderly patient population, and almost all my patients have some of the other kind of heart disease. Like I mentioned, high blood pressure, hypertension, which we also call a silent killer because it does not show the symptoms till later on, and diabetes, high cholesterol, irregular heartbeat. So yeah, almost daily.
Yeah, so as you said, you work with elderly populations, which, as we see with data, they're usually the most prone to heart disease. So, what are some things that you suggest to those patients that are more prone?
So what I see is the patient who are more prone to those kind of heart disease would be patient with high stress, low activity lifestyle. So we see that the risk factors like smoking, sedentary lifestyle, um, the diet, like people not eating healthy diet and depending too much on packaged food, all of that, and sleep. A lot of dependency on soda and junk food and fast food, all of that. So the recommendation for those kind of patients who are prone to heart disease would be definitely the lifestyle changes, and also checking their heart, also going to the primary care physician regularly so that they can do that routine check and find out the early signs early on. Like you can relate it to like a dashboard in the car. You can see those lights like low fuel or low tire and things like that early on. If you take care of it then and there, you will prevent long-term complications. But if you don't, then you slowly see all the complications with heart disease.
Yes, greatly worded. So I feel like there's this one of the biggest misconceptions is always that we should worry about heart health later on because we see it a lot later on in life. So when do you think that people should really start to worry about their heart health and really start to be cautious?
Yesterday, or I would say now, but definitely not till the problem gets worse. So, yeah, like you said, it's a misconception that it starts only later in life, especially with the change in lifestyle and diet lately. It's been shown that a lot of young people also have heart disease. So, we have to work on those lifestyle changes early on in life to prevent complications later. So
Mhm.
definitely start now. Don't wait. Don't wait. Listen to your body when it's whispering rather than waiting for it to scream that they need help. So yeah,
Yeah,
now.
exactly. Thank you so much for saying that. So, day to day, what do you think are some of the biggest misconceptions that you receive from your patients about heart health?
So some of the misconception I would say is one, like you said, I'm too young, I wouldn't have heart disease. So that's a big one of the biggest misconception because people do. And again, I would blame it on the lifestyle as well. A lot of people like they're spending too much time on screen, not doing physical activities, the mental health pressure, very high risk life, and smoking and diet, definitely the diet, the fast food, and not eating whole food. So that is one of the biggest misconception that young people don't get heart disease. The other I see is skinny people don't get heart disease, and it's only the disease of overweight population, which is also not true because the arteries can still get clogged. You can still have diabetes and high cholesterol and all of that with the lifestyle. And what else? Blood pressure. Like if you take heart medication or blood pressure medication, you'll have to take it all your life. So people are very scared to take the medication or start the medication to start with. But you can relate to something like your vision. Like if I don't see clearly at young age, I would definitely start wearing glasses, right, to improve the vision or improve the quality of life. It's the same thing. If my heart is not working good or my blood pressure is high, I would not wait really till later to get all the complications of heart attack and stroke, but I'd rather take care of it now with the blood pressure medication if needed. And again, it doesn't mean that if you start the medication now, you have to take it forever. If you work on your diet, if you work on your lifestyle, sometimes we may be able to reduce the dose of the medication, or sometimes we can even stop the medication. So
Yes.
those are, yeah, I think those were the biggest misconception I see in day-to-day life.
Yes, I absolutely agree with what you say. I feel like these are all things that people know, but they just fail to apply it to themselves because they believe they're the exception to the rule. Like we
True.
see it everywhere, and it's just hard to apply it to yourself whenever it seems like something so far-fetched.
Mm-hmm.
Yeah, I totally agree with what you're saying.
Mm-hmm.
So, as you were talking about taking medicine early on, there's this other misconception. Is it true that taking lots of medicine, even if it's prescribed by your doctor, will put you at a higher risk for heart problems?
Not totally, but yes, like if you are getting medication from too many doctors and not have that one primary care physician who will take care of everything. So if you go to a heart doctor, kidney doctor, other doctors or shop doctors around, like not too much in US, but in Nepal, we see that if you don't like one doctor, you go to the other doctor. There's no continuation of care with one doctor. So they might be getting similar kind of medication from too many doctors, and there's not one person to take care of all of it at one time. So that taking too many medication but not having that centralized one person to take care of it can cause issues. um, Something like you have too many apps open in your iPhone and it'll crash, right? So it's something like that. But polypharmacy is also one of the thing. Again, it's too many medicine, but not being controlled and not being looked after. That will cause a problem.
Yes, so definitely too much of anything can be bad, right?
True.
We can apply that.
Yeah.
Yeah, so I guess what you're trying to say, it's more about consistency, right? And about really controlling what you're taking and when you're taking it.
Yeah, that and also having somebody to control that medication. Like, for example, if you go see one doctor, they give you one blood pressure medication. You go see another doctor in a couple of months, don't mention them about the medication you're already taking, and they will add a medication. So same thing happens if you shop around and get similar kind of medication. Like you're making a tea, you put a spoon of sugar, then your mom comes and put a spoon of sugar, and somebody else comes and does the same. Like it's not really the sugar the problem, it's too many people not coordinating and pouring in the same thing.
Yeah.
So that can be a problem.
Yes, thank you so much for that. And okay, for the next question, I think this definitely affects the youth more. Like I can even vouch saying that this like I've seen it around a lot of my friends, myself even. So there's this culture of staying up really late, waking up really late, this lack of sleep, especially with school and social media and all these other things. So there's another misconception that lack of sleep or poor mental health doesn't exactly like show up in your body as physical signs. Do you believe that's true, and how does it really affect heart health specifically?
Right. Like you said, it's a misconception. So sleep and mental health really affect your heart. Um, Sleep is when our heart and brain recharges, right? And all of us need at least like 6 to 8 hours of sleep. Right now, we don't feel anything when you're young. You don't feel the pressure of it, of not sleeping enough or all the mental stress. But then your body is kind of a disease in the making. Like once you're born, something or the other is attacking your body, the lifestyle, your sleep, your hydration, all of that. So if you're not sleeping enough, you're not recharging your brain and heart, and the power in the body is still depleting. So nobody should be starting their day with like 10% of the battery life, right? You need that 100% charge in the starting of the day, and then get more accomplished during the day. So sleep, definitely, it will show it later. It affects your heart, mental health, not just for the heart disease, but for your overall health. Until and unless we take care of our mental health, we will not be able to take care of our physical health. So both of it affect heart in the long run. You may not see the issue now, but it's
Mhm.
happening inside. It's just not in the surface yet.
Yes, so
So we,
definitely what goes
yeah,
on inside shows outside.
it will. It's just a matter of time.
Yeah. Okay. Thank you so much. And moving on, this is more about physical. So we talked about mental and what's happening inside. Physically, there's also another misconception that taking vitamins and supplements, that's gonna completely like take care of all your heart related issues. Do you believe that's true? Do you recommend vitamins and supplements?
So, for your first part of the question, do I believe that vitamins will take care of everything? No, it would not. So, they are a supplement, and they're called supplement for a reason, right? So, supplement can be a bonus, but they are not replacement. So, taking vitamin C, fish oil, coenzymes, all of that, lifestyle changes, they all help. That help with preventing complication, but then it will not unclog the 90% clogged artery. That is when you need medication. So they are a supplement, but they should not be the replacement.
And along that same line, how about natural remedies? I feel like, especially in the Nepali community, there's a big belief in natural remedies and that they can fix everything, that you don't need to see the doctor. We can take care of it at home. Can you tell us a little bit more about that?
Sure, yeah, I love natural remedies, but again, we have to use all the toolkits in our toolbox. So natural remedies like garlic and turmeric and what else? Things like that, like the honey and lemon and all of that, those are really good. It helps. But then again, those are just some of the tools in the toolbox. What you really need when you need medication. So, as a primary care doctor, again, I try to focus a lot on the preventive health, right? So, I tell my patient to exercise, I tell my patient to eat healthy. I try to put medication at the last resort and try to do natural remedies first. But then when you need the medicine, you need the medicine. So, like tomatoes help with lowering cholesterol, but you cannot eat one sack of tomatoes for breakfast and lunch and dinner, right? So when you need the medicine, the medication have all of that component compressed in a tiny little pill that will help lower the cholesterol. So what would you choose? A whole like sack, like 50 pounds of tomato, or one little tiny pill that scientists have worked over years and years and brought the medication to help prevent complications like heart disease and stroke. So something like cholesterol, like I wanted to give you the example for cholesterol because cholesterol, if you take care of it now, or high blood pressure, if you take care of it now, and if you need medicine, you did your lifestyle changes, you did the natural remedies, but your blood pressure is still high. So if you take one little tiny medication now, it's going to prevent you from getting that heart attack, that stroke, that kidney failure. But if you let it be and take time to act on it, later on you might have stroke. And when you have stroke, there are at least 4 medication you need to take to prevent further stroke. Or if you have kidney failure, you have to go to dialysis 3 times a week for 3 hours a day. So you want to prevent all of that from happening by taking that one tiny little pill and not depending too much on natural remedies. They're a supplement. They're one of the tools, but we should not totally rely on it.
Yeah, so definitely do the work early on to prevent more in the future.
Definitely. Prevention is cheaper, it's better, so we have to focus on prevention. But if at all it comes a time where you have to take medicine, then we should not hesitate to take medication as well.
Okay, thank you so much. And then for our last question, heart disease can be hereditary. So let's say like someone's like mom and dad, they both have heart disease. Are they confirmed that they're also going to get it?
Um, Not really. So genes play a role, but it's like a seed, but lifestyle is the soil. So gene loads the gun, but lifestyle is the trigger. So there's certain condition where you are at higher risk of getting heart disease. And again, having heart disease in the parent, like mom and dad have high blood pressure and heart disease, does not really mean the children will definitely have heart disease and high blood pressure, because that could have been the lifestyle and the diet and the sedentary, again, sedentary lifestyle and smoking and all of that as the risk factor causing heart disease in the parents. So if the children don't do all of that, stay really focused on the lifestyle changes and eat healthy, they will not get the heart disease or high blood pressure. So it plays a role in certain condition. If it's hereditary, you might get it, but if you know beforehand, you can avoid other risk factor that can make the things worse.
Okay, so yeah, it's definitely not like a end all be all. It's not like you're confirmed. If
Right.
anything, it should be an incentive to work
Hmm.
harder not to get it.
Right. Right. Totally. Totally agree.
Okay, thank you so much. Do you have any last messages for the youth, for the community listening?
Well, first of all, thank you so much for doing this. Youth like you giving back to the community, not just here in Nepal, and raising awareness among everyone is really commendable. You all are the future and you are doing great. So thank you for that. And again, last note, I would again want to focus on the lifestyle changes, work on the physical and mental health, sleep, and hydration. So choose water in place of your soda. Go to walk, just grab a bottle and go for a walk. That will help you with your mental health and physical health both. So yeah, work on the lifestyle changes. And again, you all are doing great. So thank you. Thank you for having me.
Thank you, Dr. Nepal, for being here today and taking your time to give us this knowledge. And thank you, viewers, for watching. It's you that we do this all for. So please, if you can take anything from this interview, even just one piece of advice, it can really be life-changing for the long term. And once again, it's better to start early on rather than later be affected and regret that you didn't start. So once again, thank you so much for watching.